All right, so my name is Julie. I'm one of the PAs here that work at Claytor Noone Plastic Surgery. I am here to talk about the Silhouette Insulift Thread Lift. It uses bidirectional cones and a thread lift technology, micro-suspending the sagging skin of certain faces. The Silhouette Insulift threads are made up of poly-L-lactic acid, which stimulates your body's own collagen production. So even after the threads dissolve over 4 to 6 months, you're still getting that collagen boost for up to 2 years after the procedure is performed, which is a great cost-effective way to lift skin as well as volumize certain areas. Okay, so I wanted to talk a little bit more about what the actual threads look like. So here again, they're made up of that poly-L-lactic acid, which makes your body make collagen, along with these bidirectional cones. And the surface area of those cones allows for volume to be placed in certain areas. As you can see beforehand, she's lacking a little bit of cheek volume here. And just through threads alone, of course this is a drawing, but just through threads alone, we are able to add a little bit of cheek volume. So what happens is that they place all of the threads, and we're saying these are the placed threads. There's a little string hanging down here that I eventually cut, but I pull down on this tissue, on this thread here, which lifts all of this tissue onto the threads here. Once I'm comfortable with that, I pull on the thread up here, which lifts the whole tissue even further. And of course, I'm smoothing things out as I go, making sure it's nice and symmetric side by side. Once I'm satisfied with everything, I essentially snip that little suture, snip this one, and repeat the same process for all the threads. But what it does essentially is pulls up that tissue onto the cones to create some lift and some volume. The procedure itself has very minimal downtime. Technically, the next day, if you wanted to even go and work out, you can. Typically, I say give yourself a couple days buffer just to kind of give yourself a little time just in case you do have a little bit of bruising and swelling, but it tends to be very minimal compared to other surgical procedures or more invasive procedures. What we do is whenever you come in for the consultation, I of course make sure that you are a candidate for the procedure, and then I draw the specific vectors on your face. So you and I are in agreement to your goals and exactly how many threads you want placed and where you want the threads placed. If your concerns are more lower face, we'll maybe target them a little bit lower. If it's more mid face, we'll go a little bit higher up. And then I inject numbing medication throughout the face to make the actual threading procedure as comfortable as possible. That's typically a combination of lidocaine and epinephrine to help decrease that bruising as well. I usually bring you back for a follow-up in about a week or 2 weeks, just in case we need to take a look at anything, but issues tend to be very minimal.